being a revenue source.
You have to go.
Good afternoon, everyone.
For
If
minutes and then come back together.
So and before we do, sorry,
Rep Kennedy, you're good. You're muted now. So good afternoon, everyone. We will call the Public Health Committee meeting for February 9th, 2026 to order. The first order of business is the remarks by the chair. I would actually have my co-chair start the remarks.
Thank you very much, Senator Anwar. Happy Monday, everyone. It's wonderful to see all of you here, such a great crowd. And we are all looking forward to talking with you after the meeting. And with that, I'll turn it back to you, Senator Anwar.
And Representative Kristen McCarthy, he was speaking on her own behalf. And I know our ranking members are physically not here, but they are online. And you will see many of our members come in and out of the meeting. There are multiple meetings happening at the same time. So just be aware that we are all including all aspects. I see Representative Cletus Jetra. Representative Cletus Jetra, do you want to make any remarks?
Thank you, Mr. Chair. Good morning, everybody, or good afternoon. I also want to make a special note. Happy birthday to Representative Steinberg.
Can we say that together again? Oh, it's beautiful. Okay, thank you so much. With that, and I see Senator Summers. Senator Summers, you're on.
Yes, good morning or good afternoon, everybody. I'm looking forward to getting going for our next session of public health. Happy birthday, Jonathan.
Thank you. We will actually leave the votes open till 2 p.m. for those of our members who are not here right now and not be inclusive in the votes. The next item is concepts to be raised. I will take some of these concepts out of order. I will skip number 1 for now, and then we'll come back to that later. Item number 2, an act establishing a bridge program for emergency addiction treatment and recovery navigation. Just a word about each one of these concepts. This is a concept where an individual going through rehab for substance use can get treatment in the emergency departments to get prescription or treatment, and that would actually get them in the network to start the navigation of the rehab that they will need, and there's going to be an opportunity for better outcomes. According to the data, 3 times better rehab opportunities in that situation. Item number 3 is an act about well water. 1 out of 4 of our citizens in our state depend on well water. Parts of our state have challenges with well water. Many of our legislators and public health committee members have requested about this issue. This is something that impacts my district in Ellington. I know Senator Gordon, Representative Nuccio, Representative Foster, and many others have requested this bill. We want to try and have a conversation and see how we can make sure that there's safety around well water for our citizens in parts of our state. Next, item number 4 is an act establishing a triple bottom line justice demonstration pilot project. This is out of Bridgeport. Representative Baker is working on this for quite some time, and we wanted to make sure there's an opportunity to have a frank conversation about opportunities to address this. Item number 5 is an act establishing a licensure for long-term acute care hospitals. This is something we discussed in the previous session. LTACs are part of a federal licensure. In the state of Connecticut, we have at least 2 hospitals that would fulfill these criteria. We want to make sure that we are in sync with the federal licensure on this aspect, and see if Gaylord Hospital for Special Care can be considered in this. So this will be a conversation we want to make sure with DPH and others are on board with this. Item number 6 is requiring healthcare systems to include an alert in the medical records of patients documented as combative. This is an important bill. Representative Martinez has been a champion for this. This is, again, continuing the work of keeping our healthcare workforce safe. We are advancing further. We have moved in the right direction, but there's more areas of opportunity. As we have centralized opportunity to get electronic medical records, some of this information would be available so people are able to make sure that they are providing the care that these patients need. Nobody's restricting the care, but it needs to be there with some safety for the people providing it. And perhaps we can have a conversation on this in a little bit too. Next item, number 7, we are going to hold that for the time being and jump to item number 8. It's an act concerning the Department of Public Health's recommendations regarding unlicensed institutions and practices. The next many proposals are from the Public Health, Department of Public Health, and these are fine-tuning some of the aspects. So the simple thing is that a licensed healthcare facility, if they do wrong, there's a penalty with it. And it turns out that if an unlicensed facility is providing healthcare and they do something wrong, their penalty is a fraction of what a licensed facility has to pay, which doesn't make any sense, and this needs to be fixed, and that's part of what this bill is going to do. Next item, number 9, is the Department of Public Health's recommendations regarding on-site wastewater specialists and water operator apprentices. Again, there's a workforce issue and an opportunity for training. Water will be an important aspect, and this is something the Department of Public Health is going to be able to address. Item number 10 is an act concerning the Department of Public Health's recommendations regarding real property change of ownership. There is the healthcare system and nursing homes that are providing the care, and they are licensed, but the actual facility may change hands multiple times without any information and knowledge. So it's just important to be aware of who owns the place, so that if there's a structural issue, there is a way for the Department of Public Health to be able to help preserve the health and well-being of our citizens. Item number 11 is an act concerning the Department of Public Health's recommendations regarding the treatment of hepatitis C. This is continuing the process. In the past, this committee had recommended that there should be screening of hepatitis C. Hepatitis C, which had been one of the biggest killers across the world, is now curable. And that's why we started to make sure that everybody gets tested. Well, now that people are getting tested, we recognize that some people who get tested are not treated. This is basically saying, hey, if you diagnose it, treat it too, and then make sure they get to the right person. We have to write a law for this, but we will. And then item number 12 is an act concerning the Department of Public Health's recommendations regarding the various revisions to the environmental health and drinking water statutes. And this is, again, a continuation of making sure that there is safety around water for our citizens. And number 13 is an act concerning the Department of Public Health's recommendations regarding consent orders as well. And this, again, is a recommendation from Department of Public Health where the process still needs to go through for consent orders. And number 14 is an act concerning the Department of Public Health's recommendations regarding various revisions to the public health statutes. This is every year we have this bill which looks at minor revisions that need to be made and technical revisions for the public health at the time. So the various items that I've spoken of, if we can take vote to accept them to raise these bills, is there a motion?
So moved.
Moved by Representative Kristen McCarthy-Vahey and seconded by Senator Marks. Any discussion? And we will take a voice vote. All those in favor will say aye, and the ones who are against will say no. But what we'll do is we'll give you the opportunity to unmute yourself online. And with that, all those in favor say aye.
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 And the ayes have it. Now we move to item number 2 that we had skipped. Item number 2, go ahead. Item number 1, sorry. Item number 1 that we had skipped. See, that's why you have to have Representative Kristen McCarthy-Vahey keeping me on the right path. An act concerning reproductive rights. Then Representative Kristen McCarthy will speak about that.
Thank you very much. This bill, or the bill that we intend to raise, is going to be very familiar. Language from Senate Bill 7 last year was sections 3 and 12 originally. And this will protect providers of reproductive health care from any discipline if they're just providing counseling, referral to treatment, and providing that emergency care when necessary. So it will be very familiar language that we have discussed and debated around this circle before, but that is the proposal before us. Thank you, Senator.
And I just wanted to mention that we will have a roll call vote for this. Can I have a motion to approve this bill?
I have a question. Excuse me.
Let's move this first, and then we will have and it's been moved and seconded by Senator Marks. And on to you, Senator Summers.
Thank you. If this language is very similar to what was in SB 7, could you give us some more detail as to why we're raising this bill?
Representative Christian.
Just so we're clear.
Thank you, Senator Summers. We did not pass that language last year. It was removed in the final version of the bill. And as is the case with many of the bills that we hear, we come back to those conversations sometimes and we don't get all the way through that. As you recall, Senate Bill 7 had a large number of really important and significant initiatives. And so we're just bringing back this conversation to be able to continue and hopefully follow through on that this year. Does that
Thank you.
answer? Hopefully that answers.
Thank you for that. I just would like to know if you know, is the language going to be exactly the same, or is it tweaked in any way, shape, or form?
Once we raise this, I promise you we will be all aware of all the details. Seeing no other...
That didn't really answer my question, but thank you.
Of course. With that, Madam Administrator, can we have a roll call vote, please? Or... Oh, seconded by Senator Marks.
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy Vehi,
McCarthy Vehi votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Marks votes yes.
Senator McCory,
McCory's a yes.
Senator Summers,
Summers votes yes.
Representative Clarice Detrier,
Clarice Detrier votes yes.
Representative Burger Gibalo,
Burger Givallo votes yes.
Representative Biggins,
Representative Biggins votes yes.
Representative Carpino,
Representative Carpino votes yes.
Representative Carpino, I didn't hear you, please, if you're there.
I'm here. Representative Carpino votes yes.
Thank you. Representative Dauphiné, Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Jengo,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon, Senator Huckadell, Representative Cabras de Graw,
Gavros DeGraw votes yes.
Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Representative Morrow,
Mara votes no.
Representative Martinez,
Representative Martinez votes yes.
Representative Morin Bello,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletta,
Paletta votes yes.
Senator Rahman,
Senator Rahman votes yes.
Representative Reddington Hughes,
No.
Representative Romano,
Romano is a yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg, Representative Zupkis,
Zupkis votes no.
Representative Dauphiné, Representative Elliott, Senator Gordon, Senator Harkadel, Representative Parker, Representative Steinberg, Mr. Chair, the vote should be held open until 2 p.m., please.
Thank you. Yes, thank you for reminding me. We will keep the votes open till 2 p.m. Next item on the agenda is item we had not addressed before. This is item number 7. It's an act concerning the psychedelic assisted therapy pilot program. I can give you a little bit of a background. Back in 2022, our committee had actually, in a bipartisan fashion, approved this pilot program in the state of Connecticut to help our veterans for refractory PTSD and refractory depression with suicidality. And the reason was that the FDA had not approved this treatment, and as a result, we had placed a plan to have both the use of psilocybin and MDMA as a part of a treatment plan for our veterans in our state. This program has been underway, and this is being championed this time around by Senator Marks, who actually was in the appropriations subcommittee to be able to make sure that we had funding for this pilot. This pilot is underway. The purpose of this bill that we are raising, the concept we are raising, is that the original pilot had suggested that it would be performed if the FDA while the FDA was looking at this. It is anticipated that the FDA will approve this. We do not want our pilot and our patients to be left behind once the FDA approves this, so we want to make some technical changes to make sure that their treatments continue, and also perhaps opportunity to expand this. So we raised this bill to try and identify some of those areas to continue the program and make sure people in our state who need this treatment would get the treatment. With that, I will entertain a motion to approve this. Senator Marks moved and seconded by Representative Kristen McCarthy-Vahey. And now we have any questions or concerns or questions? Yes, Representative, go ahead. Mara.
Thank you so much, Mr. Chair. And just to confirm, I know we already had this discussion, but just so everybody else is aware, these are all going through the proper FDA process.
So this is being looked at by the FDA, and the internal agencies are looking at each one of these cases too. Correct. Thank you for that.
Yeah, no, thank you. I think, and I really appreciate that. One of the things that we've seen is people wanting to bring in psychedelics that aren't vetted the proper way and haven't gone through the proper channels. So I really agree that this is the way it should be done. And I'm happy that the state has jumped on this. However, from this point forward, it seems like this is more of an ongoing healthcare issue, maybe a Medicaid or a health insurance issue or a funding issue. Is that correct?
So in this particular bill, it's just technical revisions, but there's no funding associated with this bill.
Okay, but you would require funding to have it on an ongoing, I mean, is that correct?
No, as of right now, this bill is just the technical fix of the existing pilot, and the funding is already in place, and there's no funding associated with this particular bill.
Okay, all right, thank you.
Thank you. Senator Marks.
Yeah, thank you, Chair. And I did have the privilege of going to the clinic. It's called the Enhanced Clinic at Yale on York Street, York Ave. And it was fascinating. And right now it is just a study. So those participants that are coming to it, they actually get paid, right? Like studies that you do at most universities. So it isn't, you know, there is money and appropriations that funds it, $500,000 a year for the pilot program. And so this is just a bill to raise the concept, to see how the pilot is going, and to see if we do need to make any kind of technical changes to make it more successful. And I really look forward to the public hearing where we hear from those clinicians that are doing incredible work. It was really absolutely fascinating to go and see it. So thank you, Chair.
Thank you. Yes, Representative Zupkus.
Thank you, Mr. Chair. So this bill is a study. Is that correct?
This bill is actually, the study is already underway. This is actually looking at where the study is and if needs little tweaking for the pilot that we have requested. So the pilot words that we had included that the FDA approval at that time. And if the FDA approves that, the entire study would be impacted. So we want to make sure we make the technical adjustments to address that part. So the study is already underway.
Okay, and there is 500,000 allocated a year for how many years?
My understanding was it was just one time, but I can, we can get back to you on that, or maybe perhaps
It
Senator
is in
Marks.
this
I can speak to
biennial.
that.
Thank you, Chair. Yeah, I am co-chair of the Public Health Appropriations Subcommittee and is in this year's biennial budget.
Okay, thank you.
Thank you. Seeing no other questions or comments, Madam Administrator, can we have a roll call vote, please?
Senator Anwar,
Senator Anwar votes yes.
Representative McCarthy-Vehy,
McCarthy-Vehy votes yes.
Representative Belton,
Belton votes yes.
Senator Marks,
Senator Marks votes yes.
Senator McCory,
Senator McCory is a yes.
Senator Summers,
Summers votes yes.
Representative Clarice Detrier,
Clarice Detrier votes yes.
Representative Berger Givallo,
Berger Givallo votes yes.
Representative Biggins,
Biggins votes yes.
Representative Biggins, if you're online, I did not see you on screen, please.
Biggins votes yes.
Thank you. Representative Carpino,
Representative Carpino votes yes.
Representative Dauphiné, Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Django,
Yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Senator Gordon,
Senator Gordon votes yes.
Senator Harkadel, Representative Kitt,
Representative Kitt votes yes.
Representative Kennedy,
See on the notes,
Kennedy votes yes.
money, are we gonna address that?
Well, because if we do implement. Sorry.
Senator Kushner,
Yes.
Representative Morrow,
Mara votes yes.
Representative Martinez,
Representative Martinez votes yes.
Representative Morin,
Representative Morin Bello votes yes.
Representative Parker, Representative Paletto, Senator Rahman,
Paletto votes yes.
Senator Rahman votes yes.
thank you. Representative Reddington Hughes, Representative Romano,
Reddington Hughes votes yes.
Representative Romano,
Romano votes yes.
Senator Slabb,
Senator Slapp votes yes.
Representative Steinberg, Representative Zupkis.
Zupkis votes yes.
Thank you, Mr. Chair.
Mr. Chair.
Thank you, Madam Administrator. Yes,
I just wanted to make sure that the administrator got my vote.
sure. Senator Kushner, Madam Administrator, Senator Kushner is here. I want to make, we want to make.
I did.
Thank
And
you.
I just want to make sure you got my vote too.
Representative Redrington.
I did.
Thank you.
You're all set, thanks.
Thank you. And we will hold the votes till 2. So give me 1 second. We'll just come to the next item. Okay, we go to the next item, which is announcement of times and dates of the next meeting. There's a slight correction. If you look at the committee meeting on Wednesday, instead of February 11th, we'll say February 18th at 11:30 a.m. Can we mark that correction, please, for the record? And it was not an error, it's a change. Yes, Representative.
Thank you, Senator. I just want to confirm that we are eliminating the Wednesday, February 11th meeting and moving directly on to the meeting on the 18th.
Correct.
Thank you.
All right, and the next is a committee meeting followed by a public hearing on February 18th, 2026 at 11:30 a.m. So once we have our meeting, we'll have a public hearing. All right, with that, we are going to be in recess. Thank you, everyone.
Bev, when you're ready, I have a vote.
Are you missing the second roll call?
Yes.
How would you like to vote?
Kavros DeGraw votes yes.
Thank you.
Thank
I think I missed the first roll call on
Yes,
agenda
sir.
item 1.
You did? How would you like to vote?
I will vote yes. And was there a voice vote or some other vote on the rest of the items?
A voice vote, yes.
Okay, I vote yes as well.
Thank you.
Thank you.
Representative Biggins?
I just wanted to check to make sure I didn't miss a vote.
You didn't?
Thank you very much. Have a great
Thank
day.
you. Representative Gilchrist, you're all set.
Thank you. Have a good one.
Hi, Bev.
Open. Hi, Representative Parker, how are you?
Doing great. How are you?
I'm doing well. We did a roll call on item number 1, reproductive rights. How would you like to vote?
Yes.
And we did a roll call on item number 7. How would you like to vote?
Yes.
Thank you.
Thank you, Bev. Bye.
Bye. Yeah. Okay, this is always open. And I put this up all the way to max and I was still having problems. It started last week. That sounded okay. That was still too quiet, yes, because if there's noise in the background, I have to record their votes properly.
But the meeting ended. But they also have another meeting yesterday at 2:00. Yesterday? No, today they have another meeting. What's at 2:00? Public House Committee Chairs meeting to discuss HB 5044. Okay.
I checked my update. When was it? Last week. On Zoom, yeah. Cheryl said, be prepared. Make sure you have the latest update. So I don't know if one came out this weekend. I'll check when I'm done. Okay. Yep. Okay, I'll let you know if it happens again. I will. Thank you, Corinne. Okay, bye.
Hello, Beverly.
CE, Rhode.
Hi, Representative Elliott, how are you?
Good to see you.
We have roll call on item number 7
Yep.
and item number 1.
Okay.
For number
Yes.
1, how would you like to vote?
Yes.
And for number 7?
Yes.
Thank you. You're all set.
Thank you so much.
You're welcome.
This time it should go through. Oh, really? That's okay.
Sorry, it took me so long.
So it needs you.
Well, we need to come up with dates immediately. That's number 1 right now, right?
Yes.
So can we start with?
And I need at least 45 minutes for the rare disease and the EMS folks, and an hour for the informational forum for
It's a meeting, the firefighters.
the firefighters, a meeting, yeah. Or 45 minutes, depending on you guys.
Everything within the 45 minutes. Well, whatever, but you need,
I need
The
a lot
30
of time.
yeah, but we also need like speed round
Yes.
for us for screening, so I think. Do you should we sit down with this list and like,
Yeah.
I think like the rare disease, for example. And the EMS and the fire. How do they fit into our screening timeline? You know what I mean?
Your bills are applicable, those are not raised.
Yeah, well, we have to, all right, maybe you and I should take a few
Yeah,
minutes to
yeah,
just sit.
yeah. Yeah,
us,
leave me out of it.
Leave you out of it.
I'm
yeah.
the stepchild.
Out of it too. sorry.
Yeah.
Yeah, I'll come in your office. You know what?
Excellent, so if you
Okay.
information, who is your team, what you're doing, what entities are involved, and what time you meet or whatever, and then I'll.
You're into the bathroom and come into your office, okay? All right, thanks. I know, I'm gonna be the problem child this week. I'm going to Pennsylvania Thursday, Friday, and I have a family funeral and.
So that's why we cancel that. The 11th.
No, we did because you apparently had said to Eileen. There wasn't a ton more that had come in, but she's what we have.
Yes.
And this all, it just made sense. It gives us more time. Figure we can screen tomorrow. You know, gives us a little more time to
Hello?
Hi, Senator.
Hello, how are you?
Very well, thank you. We're taking votes for number 1 and for 7.
Okay,
Okay. How do you vote?
I vote yes for both.
Okay. Thank you very much.
Hi, Senator.
Have a good evening.
Hello, how are you?
Very well, thank you. We're taking votes for number 1 and for 7.
Okay,
Okay. How do you vote?
I vote yes for both.
Okay. Got it? Thank you very much. Hi, Senator. Have a good evening.
Hello, how are you?
Very well, thank you. We're taking votes for number 1
That's guidance from Shane.
Super Beats by Human just got an upgrade. Introducing our bold packaging, same size, same trust. One partnership with the University of Texas. This is modern cardiovascular support, all in Human. At Drive Time, we make it easy to get the car you want. Get approved, and you can control your real payments on any car. So if I like this car, but I love this other car, I can change the terms of the one they payment works for me. Yeah. This is go get your real deal at drivetime.com. Back to our top story now, the disappearance of Nancy Guthrie. We are just hours away from a second deadline that's set in the alleged forensic one. And still no suspect or even a person of interest. Alicia Acuna live outside of Nancy's home in Tucson, Arizona. She's been covering this literally since the beginning. You've been on the ground there, Alicia, for more than a week now. Have you ever covered something like this?
Well, the only other high-profile kidnapping that I covered for a very long period of time was in 2002 when Elizabeth Smart was kidnapped, when she was taken from her home by a perpetrator and who kept her for months on end. That's the only other one. And so I have seen the kind of coverage that that will bring and the mystery that surrounds it and folks trying to figure it out. What is different here is that in the Smart case, we saw the cameras on a regular basis to bring us any sort of updates that they possibly could, reaching out to their daughter, reaching out to whoever took her. We've only seen, as you know, of the Guthrie family, the videos that they've released where they're trying to reach out and talk to the person or persons who did this.
Typically, the longer these go on, the worse the outcome is. But with Elizabeth Smart, as you pointed out, she was missing for 9 months until she was finally spotted. Somebody said something and she got reunited with her family. There's some puzzling aspects to this case. I think they're apparently dealing with this ransom note. They've done the checking out the septic facility behind Nancy Guthrie's home. And they spend an awful lot of time at Andy Guthrie's house as well. What's going on there?
And that's so interesting, wasn't it? Because that happened around 8:30 in the evening on Saturday after investigators had already spent time there at Nancy Guthrie's house. They were there in the dark. And from what our Fox Digital team was able to gather, they were in there possibly with a camera for about 2.5 hours inside Annie Guthrie's home that she shares with her husband. And they could see flashes of light. It looked like it was coming from a camera. And this was going on in the garage for a while. And then it also happened in a whole other part of the house. So the big question is why at night? And we've heard Luminol they can work with that to help with discovery aspects of evidence at night. So there's that. The family.
I don't know. Yeah, she's on here, but she's in another meeting.
If they simply agree to cooperate.
Item 1 is a roll call,
Oh, hold on. Maybe my,
reproductive
no, I
rights.
can't get my volume up. Hold on, Bev. Can you hear me?
I can hear you.
Okay, hang on just a second. I got to turn this off.
This is what.
Okay, I'll have to listen real carefully because your voice isn't coming in very high. But that's okay.
Sorry.
Okay, that's okay.
Item 1. and that's
So
concerning-
was it 1 and 7 that they did not do on consent?
Yes, 1 and 7.
Okay, did anybody vote no on 1?
Yes,
Yes, because I would be a no.
okay.
And then I would be a no on 7 as well. I'm assuming there were votes that were a no. On 7, is that right?
I don't have a no so far.
Oh, you don't? Okay. Well, I'm gonna be a no.
Okay.
And that was it, Beverly?
Those were the only 2. The others are voice vote.
Okay. Okay. Thank you so much for helping me get on. I appreciate it.
You're welcome. Have
Okay.
a good
Yep.
afternoon.
Bye-bye.